Can ultrasound scan prevent sports injuries? I'm Dr. Michael Lee, pain and performance consultant here at Sheffield Sports Medicine. Thank you so much for joining me today in this group because I know that a lot of you're either here because we've treated you before and you want to learn more about not only about your own body, but more importantly, how can you maintain it so you can operate at your best anytime, anywhere, and in any environment, because we know that without health, anything else that we have doesn't really matter. So again, thank you so much for joining me today. And if you're watching it live, just put live into the chat so that I know who I'm interacting with, particularly if you're struggling with anything, just so that I can help you personally in this time as well. But again, if you're watching this as a replay, just put a replay and just write any questions that you may have, because we're just here to help you give the clarity in terms of what you may need in terms of making sure that your body is operating at its best. So firstly, this month, boy, has it gone quickly. And we've been talking about ultrasound scans this month. And of course, I'm the one that does the scans here at Sheffield Sports Medicine, really to give a clear picture in terms of what's going on in someone's body or an area of their body. And also, what's most important is actually to find out why. Why has this happened? Because this is the sad thing about, I guess, medicine and sports medicine, is that, yes, there's a lot of clinicians that do rely on scans. And they look at the scan and think, oh, this is what it is. And that's what a scan is. It just shows the result. But the problem with just showing the result and then just treating the symptoms, say if there's fluid, oh, let's inject it, or if there's scar tissue, oh, let's go shock it, or if there's a tear in the muscle, oh, let's go rest it, let's ice it, let's compress it. They just actually treat the symptoms and not the cause. And this is the problem in today's day and age, is that we're not using the data how it's meant to be used. And the great thing is that when we do ultrasound scans here, it's actually mainly to prove a hypothesis here, prove a diagnosis or a potential diagnosis of what we're thinking. This is what it is, but we're always thinking what the next step is. Why has this happened to this person? Because I'm sure, and I hope you agree as well, that when you're in pain, you definitely don't want it again. So we're thinking, why has this happened, and how do we stop it from happening again? Because this is where the ultrasound scan, when we interpret it, it actually tells a story. This is the result. This is what's happened to this person. This is where they've got fluid. This is why they've got bleeding. This is why there's a tear. This is why there's arthritis. This is why the cartilage is broken. This is why the capsule's blown up. It tells us a story. But then we need to figure out why. And generally the why, when you scan an area, because I've just finished scanning a patient's wrist today, and they had something called intersection syndrome, where the tendons are rubbing together. I had to ask the question, why? Why is that happening? And the why is this. Generally, whenever someone has pain in one area, whether it's the wrist, whether it's the shoulder, whether it's your knee, whether it's your neck, whether it's your back, wherever we scan, if there's something that's showing some sort of damage, some sort of fluid, some sort of bleeding, the general consensus is that it's overloaded. There's a reason why this happened, because the question is that if something's happening in someone's body, why is it happening now? Something's happened, because at the end of the day, they weren't born with this problem. Something's happened now, right? And we need to find out why has it happened now. But most importantly, if somebody's overloading, say it's a lady's wrist, it was overloading because actually all the muscles around her elbow, her shoulder, her chest, her back, upper back, and her neck, none of them worked. So just think about it. If something isn't working, other muscles have to do the job of the muscles that are not working. So this is why we have the bigger picture thinking of, let's look at a whole picture of this patient to really find out what's going on in their body, and then give them the opportunity to then rectify it and stop it from coming back again. Because this is the great thing. Whenever we scan someone, say it's a Achilles tendon, for example, and then we find that it's thicker than, so it's generally between 1.4 to 1.6 centimeters. And if it's thicker than that, then we know actually something's not normal here. Something's made it thicker and it's been overloading for a long period of time. But the thing is that because it's thicker, it is our duty of care to treat the structure because the structure is damaged. So this is one of the benefits of ultrasound. We can measure how thick or how bad something is because once we measure it, we now know where they've started, and then we do an intervention, then we measure again, then we know what the change is. Because this is where we need to make sure that whatever intervention we're doing, it's making a change to their symptoms, which is great, but also it's making a change to make their bodies robust so this problem doesn't come back again. I hope that makes sense. So when we're actually measuring and giving that intervention, say for example, there's scar tissue in the patient's Achilles tendon, we have to break down the scar tissue and put shockwave. Because this is a problem with a lot of clinics around not just in the UK or in Sheffield or even in the world. They shock blindly. They don't even scan the area and they kind of, oh yeah, because there's pain, I'm going to shock it. But the whole purpose and the whole theory of shockwave is to break down scar tissue. If they haven't scanned it, they can't see if anything's thicker, there's actually no point shocking. It's a bit like when patients say to me, Michael, I need an injection. I'm like, yeah, I could give you one, but I only can give you one if there's something to inject, right? Because the most common thing to inject is steroid. And if I scan and there's no fluid, what's the point of injecting? Because there's nothing that the steroid can do. So this is I guess it's something I always see in the NHS as well, that they're giving injections like steroid, not even if there isn't any fluid there, just in the hope that actually it's going to improve. So it's about making sure the clinical thinking is right. That actually we can actually see there's a problem, and whatever we're going to apply is going to improve them. So yeah, so when there's a structural problem, so there's fluid, fine. If there's a lot of fluid, put steroid in there. But if there's like lots of arthritis, so it's mild to moderate, fine. Put lots of ostenin in there, so it's going to help lubricate the joint better. Great, we can do that. If there's lots of scar tissue, go and shock it. So we need to treat the area that's really overloaded, because if we don't do that, we're not actually helping it heal. We need to make sure it heals. But the thing is that that's only step one. Because step two is this, and this applies to, yes, if we find something on the scan, but it also applies to the scans that we say, oh, I've got pain on my wrist, you scan it, there's nothing there. There's no fluid, there's no tears, there's no bleeding, but you're in pain. So you might find nothing. So this is where step two is. But we must complete step one if there's a structural problem, but if there's no structural problem, go to step two. Now we need to find out what's not working in the system. And this is the beauty about the scan. It gives us confirmation of what our next step is. So when we're actually scanning, if there's structure, treat the structure. Once the structure has been treated, go to step two. But if there's no structural damage, go to step two anyway. Find out what's not working in the system, get it working. Then wherever the area has been overloaded and it's become painful, won't need to work so hard, so it's not overloading anymore. I hope that makes sense. So if that makes sense, just let me know in the chat so that I know that you guys are learning as well. So that's what we do, because this is the great thing about ultrasound. This is how it helps prevent sports injuries moving forwards. Because if we find there's nothing showing in the ultrasound scan, and then we treat the areas that are not working, I've already prevented that area from then becoming a structural problem, from it tearing, from it having scar tissue, from having fluid, from having bleeding, from having arthritis. I've prevented it because I already know what the next step is. I hope that's making sense. So this is that's the second thing that's really good about ultrasound. The third thing now is that, of course, because ultrasound is very dynamic, it's very different to an MRI scan or a CT scan or an X-ray. Because the good thing is when we're scanning something, we can ask them to get my hand in the camera. We can ask them to move the wrist, so we see the tendons glide underneath the scanner itself. We can actually see how if joints get compressed. We can see if tendons get compressed. And it's very dynamic because when we see it, then we know what's happening and what we can do to treat it. So for example, if I had to put an injection in an area on the ultrasound, I can see exactly where that medicine, so whether it's a steroid or Locan, is going, or if it's osteo, if it's going right into the joint that's so arthritic, so it can stimulate more lubricants, synovial fluid, to get the joint moving. I know it's exactly where it's meant to be, and then it's going to have a better outcome as well, because the ultrasound gives us the clarity. Because I wish I had, like they say, X-ray vision or ultrasound vision, so we can see where it's going. But honestly, if I just looked at someone's skin, I can't see where the needle is. I can gauge it, I can guess, but ultrasound gives us that clarity and certainty as well. But ultimately, like I said, that ultrasound is not just about injections, it helps with shockwave therapy too. And it tells us where the thickest part is and where we need to shock. Because once we actually shocking in the right area, this is going to be preventing it from breaking down again, right? Because it's helping the most damaged area repair faster too. But this is the third most beneficial part of ultrasound to prevent sports injuries, is that it helps in our treatment. Because yes, we can treat, and a lot of you know that in terms of what I teach around the world is about neurology, and actually find out why things happen, why are certain areas in the body, what's not working, what is working. Let's get the things that are not working again. It helps us treat and prevent things from breaking down in the future, because my mission in life is to make sure that everyone can live a healthy and happier life without any pain, but also make sure their system is so robust they can do all the things that they love doing, whether it is sports, hobbies, picking up grandchildren, playing with children, whatever it may be. But ultimately, the scanning is a vital tool in seeing how robust a person is. And that's our passion to help as many people as possible and make sure that you, if you're watching this, if you know someone that's struggling with something, they've got chronic pain, maybe they're scanned first. Or even in chronic pain, maybe they just need an assessment to find out what's working, what's not. But essentially, if you know someone that's helping, please let us know. Let us know, because we would love to help them, because I know that if you have loved ones that are really struggling and suffering, you won't want them to struggle or suffer for much longer, because you know what pain feels like. It's not a nice place to be, and you helping other people, especially if you're in this group, you know what we do. So if you know other people that are struggling or are having chronic pain or had pain for longer than 8 weeks, we know it's a neurological problem, but also we might need to scan it to see what structural damage there is as well. So I really hope that you found that this live, wherever you're checking in from, in the Facebook group, whether it's on Twitter or even on YouTube, that you found this really helpful. And of course, if you've got questions, please do just post it into the comments, particularly if you're in Sheffield in the local area. We're here to help you live healthy and happy lives and get back to your best as soon as possible as well. So again, thank you for your time, for joining me today on Thursday afternoon. I really hope all of you have a wonderful rest of the week, and you have an awesome weekend as well. And I look forward to seeing all of you next Thursday for the next live as well. Other than that, have a lovely day, and I'll see you all soon. Bye for now.